With the outbreak of the COVID-19 pandemic in March 2020, the Christian Health Association of Ghana in July that same year launched a project that aimed at complementing the government's efforts against the pandemic. The COVID-19 response and institutional capacity building project also focused on providing training sessions to health professionals, who in turn had community sensitization exercises to educate the masses on the COVID-19 prevention protocols. Though COVID-19 is not so much an issue today as the municipality has no active case, the CREEP project is still on course. Irene Ngula is a health service administrator at the Techiman Holy Family Hospital and in charge of the CREEP project.
We organize an update to citizens. So our health team goes into the community to give updates on COVID situations to the population. We are not relenting in our fight against COVID. COVID is still here with us. And so CREEP hasn't also ended yet, no. So we are still on the fight.
Municipal Director of Health Services, Dr. Kusi Fosuini, lauded the CREEP project and noted that the program has helped the Municipal Health Directorate in its quest to fight the COVID-19 pandemic.
The CREEP project is so important. It affords us the platform to bring together all the stakeholders. Of course, COVID has taught us that fighting a pandemic is a team effort. So what CREEP does is to bring the stakeholders together. We review our strategies, we look at the data, and then we look at the next steps forward, what else we can do to sustain the gains. And where we've fallen short, we make amends and then we move on. So basically, that's what CREEP does.
He, however, disclosed that though the municipality has no active case currently, the Directorate is liaising up with key stakeholders, including the media, to encourage more people to accept the COVID-19 vaccines.
The key thing is the awareness creation involving partners. And we in the health sector, we've learned that, look, when it comes to vaccination, it's not the work of Ghana Health Service alone, but everybody has a role to play, especially the media.
For the Holy Family Hospital, which served as a regional referral center for critical COVID-19 patients during the peak of the pandemic, the facility is not relenting on its efforts towards helping combat the disease. Mr. Christopher Kambobnab is the hospital administrator at the Holy Family Hospital.
As we know, at least we still have some active cases in Ghana. Techiman being what it is, a melting pot by courtesy of the market. Therefore, as a hospital, we are still on very high alert in terms of the measures, strict adherence to IPC protocols, high suspicion by clinicians, and of course, preparedness in terms of isolation facilities in case a case is identified. This, we can never lose our guard, because the moment we do, that's when we might be taken unawares and we'll be caught pants down. And so as an institution, we cannot afford to relent on our efforts to be prepared and be ready at any point in time to receive any case, should there be one.
Anas Sabit, Joy News, Techiman.